for the superior petrosal sinus. Again, it's going to be right around here and here, because here's the groove for the inferior petrosal. The inferior petrosal, they both meet up into the sigmoid area. Groove for the greater petrosal nerve. I think it's... Can we check? I'm pretty sure it's 130.
130. Slow down. Hiatus and groove for lesser.
Lesser. So 130 is lesser, and
134?
134? Vague. Because here's the depression for the trigeminal ganglion. It's in this right here. So this is real vague. So it's lesser petrosal nerve, greater petrosal nerve, and depression for the trigeminal ganglion should be right around here. In terms of number, I don't know what number it is. Maybe we could, I think it'd be worth checking.
131. Trigeminal impression.
Okay, so that's not. Yeah. It's kind of backwards. This would kind of more likely be the groove for the greater petrosal nerve, trigeminal ganglion. Okay. Mandibular fossa is going to be there, because the mandible hooks in right there. External auditory meatus and mastoid notch is going to be right in here. So that's mastoid process, here's mastoid notch. Temporal bone cut open, they need a different model.
Okay.
Sphenoid.
They have a sphenoid over there.
Okay. I don't know the lingua. The sphinofrontal. I don't know some of these searchers. The optic canal is going to be there. See that hole up here? The superior orbital fissure is going to be here.
What, the optic canal is the small?
I think it should be 11.
Optic canal.
Yeah, this should only fit the optic nerve. Yeah. And this is going to be the superior orbital fissure right up here.
And the inferior was the...
Right down here.
Okay.
And flip it. Now we're going to have lateral pterygoid plate and medial pterygoid plate. Pterygoid hamulus should be here. 71, I guess. Is it?
Mm-hmm.
Okay, yeah, because it should be off the medial. Great wing. Dorsum sali should be right in between the posteriors. So I don't know what, 127, I guess? Okay. And then the hypophyseal fossa should be 125, or sella turcica.
Sella turcica.
Pterygoid canal. That's something she would ask with the disarticulated one, I think, because it's going to be right around here. Foramen ovale, foramen spinosum, foramen rotundum, and sphenoid sinus. You got to see it like cut open. Miscellaneous. Jugular foramen. Anterior, middle, posterior fossa. Vague.
And it just like. Yeah, that's what I was thinking. Anterior, middle, and posterior. Like just the whole bowl.
Yeah. Yeah. You guys can do those.
Yeah, it's not bad.
Lambdoid. I remember lambdoid.
Yeah.
Let's see if it. Yeah,
I refuse
it's
to
also
learn it.
misspelled here. Lambdoid.
I'm not learning the rest of it.
The sutures are pretty kind of self-explanatory, though, I guess, even though I forgot them. Like frontonasal, it's just the frontal bone and the nasal bone, so 30. That short little suture right there.
Yep.
Frontal maxillary is going to be right next to it. Intermaxillary is going to be right here. Squamous? I forget. It's somewhere
Yeah,
in
it's
here.
that one, yeah.
These are the ones that are really hard to find.
This is really testy.
They're, what's 62?
Pterygomaxillary fissure.
Okay.
Pterygopalatine fossa.
This, if pterygo is 62 pterygomaxillary, both,
It says and.
and pterygomaxillary fissure and pterygo.
Palatine fossa.
Okay, so know that. Pterygopalatine fossa and pterygomaxillary fissure. There's a model of the eye where it's a lot easier to see the big one. But she's not going to ask about that. There are 2 Rowan pictures that have this, by the way. So, because that's the only way you can see it. It's really tough. Petrotympanic fissure. I think it's going to be on this, when you guys do this bone. When you open it up, you can see it. Oh, but it's hidden.